Dunstan Hospital is our rural hospital that serves the regions of Upper Clutha and Central Otago. We've been around for over 100 years, and we manage to look after 93% of patients that come through our doors locally, and manage that episode of care definitively there, which means a hell of a lot less travel for all of our local residents, really. Having that hospital level care based in our region is really important for that sense of place. We find patients are a lot more comfortable in being looked after in their region, and of course their friends and family can come and visit, which is really important for their wellbeing while they're in hospital, to have that support network nearby. It's a really big challenge, the growth that we're facing. We all know how quickly our region has grown, and health planning classically doesn't keep up with that. So our hospital was designed for a much smaller population, and as a result, population's grown and we're getting pretty stretched. There's a number of illnesses that are really time critical to get into hospital and get care started that will prevent further decline in patients, and having that available locally is really important so they don't deteriorate while they're waiting on care. We all know the government can only buy so much as far as healthcare and in fact all services go, and that leaves a gap between baseline and excellent, and I guess we want to be able to provide the best possible care locally. Unfortunately that costs money. One of the big pressures we're under at the moment is our assessment area, and that's the sort of front door where patients will arrive when they're sick. Currently we've got 2 beds there, which result in a hell of a lot of juggling for our nurse, and we need more space to keep up with the volumes we're seeing now. I think the community donations will allow us to really move the envelope from baseline care to what we want to deliver, which is is best possible care, and that will allow us to buy a lot of the nice to have items, make the environment a lot more comfortable for patients, and access some better technologies as well that will just enhance the care that we already provide and take it to the next level. So I guess any upgrade to the facility at Dunstan is sort of needs to be staged in a way that one upgrade will affect the others. And as I mentioned, the assessment area is really short on space, but the other area of a lot of pressure is our day stay or chemo unit, which is delivering a fantastic job of chemotherapy or cancer infusions closer to home, but they are out of space, and the combination of developing a new chemo space will allow us to then expand our assessment area into where that currently is, and ideally improve both our pressure points in one go. In 10 to 20 years we anticipate we're going to see continued growth in the area, which is going to mean we need a hell of a lot more services locally. Exactly what that looks like needs to be planned across the entire region, taking into account the Queenstown Lakes area as well, but certainly in our region we'd love to be able to deliver surgical and operative capabilities, and Dunstan Hospital absolutely sees our role as being part of that and a key partner in delivering care across our greater region. We are a community-owned organisation. We're a trust, so our community owns Dunstan Hospital, and so the buy-in from the community means they can be part of that, and they can really enable us to make sure healthcare in this region is delivered in the best possible way. Our job as doctors, day to day, we're under the pump, and we don't have a lot of time to think about the what if and what else we could do. But certainly when you have those moments, there's a lot of extra equipment. How could this facility be better? How could it flow better? What would make patients more comfortable? Because when they turn up at hospital, they're having a bad day. and it's our job to both look after their healthcare needs, but also acknowledge that this is not a good day for the patient, and anything we can do to improve that environment and make it as seamless as possible for them to start their journey to recovery is really important. And I think that's where the Dunstan Hospital Foundation and getting that, the facility and the environment right, will really just make patient care more seamless and overall a more pleasant experience. I think the important thing is when you're sick, you want to be at home, right? You don't want to be outside your own environment. So not having to travel to an unfamiliar city, spend time in a motel room or someone else's house perched in, in a spare room, or that's somewhere that's not your own, being able to come down, have your chemotherapy or your cancer infusions, and then go back to the comfort of your own house is massive psychologically, and having your support network around you, I think, will make a huge difference for patients. Outpatient appointments, we know visiting a city for a free outpatient appointment, a study a number of years ago by one of my colleagues showed that a free outpatient appointment actually costs someone about $700 if they've got to go to the city. And that's accommodation, travel, time off work, and all those unmeasured things that they go for the appointment that is free. But being able to have that locally again in our region removes a hell of a lot of that burden that is completely unfair that people in our region face.